Welcome to the telehealth spine exam. First thing is ensuring the patient has at least 6 feet in front of them and 6 feet behind before you begin the encounter. First, we will have the patient face the back of the room and assess for any skin changes. Here, we'll be looking at any erythema, ecchymosis, scars, or abrasions. Next, have them turn around and in the coronal plane posture, here we're going to be assessing for any symmetry, lateral curvature, pelvic asymmetry, or shoulder asymmetry. Next, have them turn in the sagittal plane posture. Here we're assessing for symmetry, lumbar lordosis, or thoracic kyphosis. Next, have them go to the back of the room, and here we're going to be assessing gait. So first, ensuring that the camera is in good position to be able to assess their gait. Here we're assessing for normal, antalgic, or Trendelenburg, where the hip seems to drop with every step. Here we'll also assess toe walking and their ability, their inability, or ability with difficulty. Also here we can assess for heel walking as well. Next, have them come to in front of the camera, and here we're going to be assessing range of motion. First, we're going to start with lumbar lateral flexion. So facing the camera, having the patient have their hand at the side and trying to touch their lateral aspect of the knee and switching to the other side. In the sagittal plane posture, we're going to assess for lumbar forward flexion, trying to have the patient touch their toes, and lumbar extension. With the use of the chair, we're also going to assess single leg squat on the right leg and the left leg, making sure you're doing it in the coronal plane posture and also the sagittal plane as well. Next, we're going to move on to pain with self-palpation, some of the special maneuvers. So having the patient come to the front of the camera and turning to the back of the room. Here, we're going to assess for pain on self-palpation of the PSIS, posterior superior iliac spine, the ischial tuberosity, greater trochanter, paraspinal musculature on the left, the midline, and the right. Next, we're going to have the patient sit and do the slump test. Here, the patient will grab a chair, and as they are extending their knee, they're going to be slumping over that knee. Next, we're going to assess their ability to rise from a chair without using their arms. And second to last test, we're going to have them do the stork test, where they'll use the chair for assistance. They will raise one leg and extend their back. And last but not least, we will do the supine straight leg raise, making sure the camera is able to visualize the patient on the floor, and patient keeps their leg extended with raising it above. This concludes the telehealth spine exam.